I would normally introduce this next guy with an Italian accent, but I'm not going to do it today.
Forget about it.
Forget about it. Bill Mollica. Let me see if I can remember this. He got his master's in human anatomy, I think, from Farley Dickinson.
Yeah.
Then he graduated from the University of New Jersey Medicine and Dental School.
That's true.
He's an author. He's a lecturer.
Excellent.
He is a master in the academy.
What?
He's on the board of directors. He's the chair of the periodontal committee, which is why he's up here doing this. And he runs the American College of Integrative Medicine and Dentistry, ACIMD. Ask me about that later if you guys have any questions, because he may not fully touch on it today. I don't know. Will you?
No.
Okay. So be sure you grab me and say, what's ACIMD? And I promise I'll share some good stuff with you. Phil. So,
yes.
Hey, as I mentioned this morning, too, we changed the program at this meeting because of feedback. Honestly, like they wanted more of this. So I cut down the morning, made it much less, and made the entire afternoon to biologics. Because this is what we really do. This is the application of our work. This is whole body health. This is not teeth so much. But the last hour will be biological periodontal therapy with Dr. Gossweiler. So if you want to get down to the nitty-gritty on what do I do for my perio patients, that'll be the last hour. Okay? We'll have 2 breaks. I'll let you know when they are.
Thank you very much.
No further ado, Dr. Phil Mollica.
Hey, thank you, ladies and gentlemen. It's nice being in Vegas again. Okay, there we wake right up. Barbara, how you doing out there, Barbara? It's good to see you. Where's Lou? Missing, huh? Yeah, well. Anyhow, so this is great. I mean, I'm involved in this academy, I don't know, since I always go back to Crystal City. That's maybe close to 20 years ago. And the cornerstone for this academy, which was brilliant at the beginning, was the issues associated with mercury and fluoride. But now we finally transcended into the world of, biologic dentistry. I mean, what is that really all about? So we're going to have a little discussion. We're going to go down the rabbit hole today a little bit about my experience becoming what I consider a biologic dentist. And many of the faculty, the speakers here, our administration have come through our program and defined themselves as biologic dentists. So let's see if this actually works, which is not. Oh, it does work, ladies and gentlemen. So welcome to our world. And like we talked about is, why are we here? Well, there's a multiplicity of different reasons. And, I've discovered over the years, I've been practicing now with my dear wife for 36 years of dentistry. And we're still having fun. We haven't physically really killed any patients yet, even though we want to strangle them a few times, as you well know. But beyond that, it's a journey. And it's really a transformation. I can't tell you how many years ago. It's maybe 25, 26 years ago. It could be 27 years ago. I'm drilling away, and I'm sitting here. I says, my God. I says, I'm drilling holes in teeth, plugging them up with amalgam fillings and all this kind of stuff. Oh, my margins. Oh, I love my margins. They're fantastic. Oh, that smile looks great. I says, this is it. I'm going to drill holes and drill circles around teeth and put things on it, and that's it. I says, this is frustrating. There's got to be a better way. So after I got out of, first of all, before I went to dental school, I enrolled in a master's program in human anatomy, which was fantastic. I lived with dead people for 2 years. It was awesome. No feedback. It was great. I'm telling you, it was unbelievable. We did histology, learned how to do research methodology, histology. Fantastic. So my dear wife wants to go to dental school. So I said, okay, let's see. I have an option. For my mentors, I can go to medical school. I go on for a PhD program, or go to dental school. And at that time, I was teaching anatomy in a dental school at that time, Philly Dickinson University School of Dentistry at that time. It was a private institution. And I looked at the PhD program. My mentor says, listen, you have a research degree, get a clinical degree, so you can always do research on humans and stuff like that down the road. I said, okay. I looked at the lifestyle of the physician. I said, ooh, that's not for me. There is no life, okay? Then I looked at dentistry because my dear wife wanted to go to dental school, wife-to-be actually at that time, and it looked great. I own my own business, do what the hell I want. It's fantastic, make some decent money. So off we go. We get married 2 weeks before dental school, and we honeymoon for 4 years of dental bliss. I hated dental school. My freshman year was great. I got paid to teach anatomy again, all kinds of cool stuff. But my God, it was so linear. It was like, you all went to dental school, hygiene school. It was like, dun, dun, oh my God. So I come from a program in anatomy, our hair is long, our beards are long, we're doing research, all kinds of cool stuff, until, yes, sir, I love dentistry, yes, sir, I love dentistry, yes, sir, I love dentistry. So I couldn't wait to get the hell out of dental school. I'm ready to graduate, and one of the department chairs says, Phil, we have this oral facial pain program. Why don't you stay for another year with us? I go, oh my God. And I'm like, okay, why not? Like an idiot. There was wonderful guys, Bill Sonati, Art Greeter. I mean, these are guys, Harold Gell. These are the icons of the oral facial pain world. At that time, we called it craniomandibular disorders, TMD disorders, okay, DMJ. So I stayed for the year. And of course, not knowing any better, it was wonderful. It was how to make the best orthotic, okay, great. How to use an ultrasound wand, and that's about it, okay. So I, graduate from that, wonderful. We open up our practice, and I wind up becoming a section chief of oral facial pain at one of the university medical centers. So I see all these crazy patients and stuff like that, and I'm saying, you know what? Orthotics and ultrasound and stuff, there's got to be a better answer, how to fix people. So we started looking at things look at the body as a whole thing. So my next step in my journey was I was introduced to the concept of cranial osteopathy. And as an anatomist, I'm sitting in this lecture one day, and this guy talks about cranial bones moving. And it was like, a little light bulb, a little ding, like this. I said, holy cow. I'm used to dead people. I didn't realize things really move. Okay? So from there, the journey continued. I went to the best cranial osteopaths in the world, did cranial work, all kinds of cool stuff, trying to fix people. Part of the journey. Then one day, I'm in a cranial orthopedic class, cranial orthopedic physics class. Bizarre, okay? But I met a number of good friends with it. I was introduced to the concept of integrative medicine. From there, back in 96-ish, 97, I enrolled in a doctorate program in integrative medicine and naturopathy. Well, boy, did that change my life. Because now I went to an institution that brought all the healing modalities together. And the concept I came out of there is that other than putting Band-Aids on, this is how my daughter, who's a cardiac nurse, she works in a hospital, very, good hospital. And she says, oh my God, she says, Dad, knowing the work that we do in our office, all we do is put Band-Aids on people. We're putting a Band-Aid on. Then when the Band-Aid fails, we put another Band-Aid on. A bigger Band-Aid, a bigger Band-Aid, a bigger Band-Aid, until guess what? You can't put a Band-Aid anymore. So that's how that kind of model works. Allopathic medicine is wonderful, and it's part of the integrative concept. It's great for getting you out of a real crisis or cutting something out of you, but it really doesn't know how to keep you healthy and well. So how do we, thinking differently, how do we help our patients do what? Heal themselves. How do we help them to heal themselves? So, welcome to our world. And I'm going backwards, which is wonderful. Welcome again to my world. So, these are my little bulldogs. So, why are we here? Well, we're here to expand our knowledge and help our patients. But, it's something interesting as you evolve into this biologic world. As we're helping our patients in a different way, other than putting a great filling in or a great crown or something like that, helping them to heal, but we also heal ourselves. So goal one, we want to feel good, that's for sure, and have fun. And everybody should have a little rainbow shine on them. It's a little cloudy out today, but there's always a rainbow around us. So we want to have fun, and this is what we're going to do this afternoon, because this is a wonderful shift in our curriculum here that we're going to actually talk about biologics, okay? We're going to transcend teeth per se and talk about healing and biologics itself. So what's important, goal number 2, is how do we define ourselves? And this is part of the program where we took the concepts of Capital University of Integrative Medicine and redeveloped it so we can define ourselves. What is a biologic dentist? You take, 10, 15 biologic dentists, what they call them physiologic dentists. I'm a holistic, I'm this and that. What the hell does that mean? You ask them each time, well, I take out mercury and I don't drink fluoride. And what else is there? There's a lot more to it. So we have to try to define ourselves, especially in this emerging, I don't want to even call it a specialty, but a calling to help our patients, once again, heal themselves. So, what is a biologic dentist? What is a biologic dentist? How do we do that? The first thing is, you have to get out of the mechanistic head. When you think about dentistry, it becomes very mechanistic in a lot of ways. That perfect crown, that perfect inlay, onlay, perfect bridge, etc. Ooh, that smile looks good. But a lot of things go on today that we kind of like, what is going on with these patients that are different today? Why are we seeing so many implant failures? Why are we seeing different things going on? So we have to think, what's the underpinnings of this? What's the biologic causes? And we have to think differently in a biologic manner itself. I'll get this right sooner or later. So, as in anything in the health-related area, we have to have a coherent model to work within that gives us guidance and a pathway to support our patients' innate healing processes. And this is where we came up with the concept of integrated biologic dentistry. Because when we integrate, we're talking about a multiplicity of different healing models. And what's really important for you today is, and you've seen this in your patients, okay, whether you're entering the biologic field or been in there for a while, these patients come to you because they want something different. And I'll talk about how they test you. And if you pass the test, you are really golden. You're good to go. There we go. All right. So now we know when we think differently, we're thinking biologically, we're thinking of the body as one thing, which it thinks itself. Okay, the body doesn't understand its nose. It doesn't understand eyes, ear. It doesn't understand that. What it understands itself as one thing. So when we have situations like this, is this a local or systemic issue? Obviously, we have a focus of infection, yeah. But if you don't think there's far-reaching implications of the infection, remember all these bacterial forms, which Mike Osweiler will talk about later on, the far-reaching effects as far as septicemia, bacteremia. The bugs are smart. They know how to change your ecology to adapt to what they like. And remember, one fundamental concept, which we'll touch on again, is that in reality, we are a superorganism. We're amazing how we function. But you got to realize that 90% of you is what? Bacteria. Now, I'm not talking about size. 10% of us, number-wise, is mammal cells. So if we think about it, for years and years and years and years, we've gone back. What have we been trying to do? Well, we've been trying to kill 90% of us, and we're paying the price for that now. With all the antibiotic therapies, all the crazy things we've done to ourselves. So in a biologic sense, how do we change this ecology to something more favorable to the patient? Not necessarily just destroy, go in there with a nuclear bomb, destroy the bacteria, oh, it's sterile, this is great. Nonsense. There's bacteria throughout your body. They're finding it everywhere. They're finding it in the central nervous system. These bacteria are brilliant. They're producing things we need. We keep killing them. God knows what we're going to transform into. We see a lot of weird things today with the kids today, with adults getting all these bizarre chronic diseases. Where is that all coming from? Where is that coming? It's not the fact that believe me, we're living longer. So we have to take into consideration the far-reaching implications of an infective state like this. Remember, we are well colonized. A good colony of bacteria is supportive to health and wellness. That's how you digest food. Simple thing, we talked about it last weekend in New Jersey. We talked about the bacteria of the gut. A simple thing, what's so important about a healthy gut, first of all, is where your immune system lives, but also things the bacteria produce. Serotonin, everybody like their serotonin? Serotonin is a happy drug. It's a wonderful thing, but it's produced by the bacteria in your gut. You have a dysbiotic gut, imbalance in there, things can change. Chronic depression, etc. So we look at this, and remember, when we have infective states like this, where something changed ecologically, emerged out of the colony and became what we call infection, they're happy in there. But it's the poop and pee that kills you. That's what gets you. Those endotoxins, neurotoxins, okay, those fungal toxins. That's what really wears you down, slow and insidious way. So today, we're seeing things differently from when I went to dental school. We're seeing lesions like this. I see necrotic lesions. Other than environmental issues, which is the biggest thing we deal with per se, I mean the environmental things that we do. Talk about bisphosphonate drugs. This is a case I've shown this many times, but it just drives the point home. Bisphosphonate, fantastic. Originally developed as an anti-cancer type of thing, a chemotherapeutic agent to slow down the invasion of cancer in bone, or et cetera, osteopenia, whatever the case may be. But it's fantastic. Wow, the bone's becoming denser. Maybe we have a nice off-label use, but take in consideration the biologics associated with it, where what you're basically doing is salting the bone with a phosphate. Years ago, they used to mine phosphates in them, in the earth, dig it out. And there was a horrible thing called fuzzy jaw. The phosphates poison things. In this case, these bisphosphonates, what they do is poison what? The osteoclast. Bone's amazing. I mean, it's a dynamic, it's an incredible ecological system. Constantly turning over, bone's very flexible, it bends, it cannot be rigid, it'll break. Incredible system. It's intelligent. It's well balanced in a healthy situation. Okay, so let's poison it. Let's salt the bone with this particular drug. The osteoclasts come down. They think they know, hey, it's time to take my pal, the little osteocyte out, relieve him. He's tired, he's had it. We need some fresh bone. They come down, land on there, start to dissolve that bone. It's amazing osteoclast. It seals around the bone like a little spaceship coming down, seals it all, starts producing protons and acid, dissolves the bone, and gets poisoned. What it winds up doing is leaving the poor osteocyte trapped in the bone. And all they know is, I got to make bone. I'm making bone. Until eventually, they can't make any more bone. They can get slowly worn out. And what you wind up is, sure, you get your much denser bone, but it's a fake out. You wind up with dead, old, brittle bone. And we see a situation like this in the oral cavity from these pharmaceutical drugs. The problem with these pharmaceutical bisphosphonates today is that they can't be broken down hydrolytically. And when the fundamental things of biology is what? The essence of the functionality of what? Water. Water. Water is the universal solvent. Your body breaks things down by hydrolysis, making things wetter so you can poop and pee it out. When you're making something hydrolytically resistant, you can't get rid of it. And you accumulate it. Accumulated, till the garbage can gets so filled up, boom, whatever your propensity for some disease state pops out. And you go, oh, what happened? When we deal with these chronicity of diseases today, and this is just a quick flashback, this is the guy's maxilla. This is, you see the floor of the sinus. I don't know if this has a laser on it. Maybe it does. Oh, it does. This is the floor of his maxillary sinus. This is alveolus. Man, you think antibiotics is going to fix this problem? No, it doesn't. The problem is that in cases like this, the vascular beds have collapsed down. Clear, coherent information from the body is not getting to these areas to help it heal. So if you look at this biologically, how are we going to get this tissue, the vascular beds open once again, get clear, coherent information to this tissue to allow and support, not so much even allow, support the patient's innate healing processes. This patient was on antibiotics for 6 months. It didn't work. That's insanity. The result of 6 months of antibiotics, you think he had an immune system left? It was wiped out. He had a sterile gut. 80% of your immune system lives where? In the gut. And remember about the gut. It's an external organ housed inside. This would be kind of nasty dragging your guts around. This is how we perceive the world in a different way, through our GI tract. Why do we swallow? Get the spit out of your mouth? No. our perception of the world is kind of interesting. We see, we feel, you touch things, you can do all this kind of cool stuff. That's great. But in a deeper sense, there's a deeper perception of the world, and that goes through your gut. Every time you swallow, you're perceiving what's going on. You're sniffing your environment. And the immune system is now sorting it out. Do we need to challenge? Are we challenged by an antigen? Do we have tolerance? So in a deeper sense, your body is always perceiving the world itself. And when it loses that deeper perception, that's when we run into these deeper chronicities of disease itself. So a situation like this, we call it dysregulated tissue because it's not getting good information. As dentists, I know, and we're going to talk about this in a little while, we love epithelial cells, don't you? I know you right there. He's studying very well right there. He's not looking, and now he's looking at me. He loves epithelial cells. Why? Because listen, think about it. If you're just strictly dental mental, okay, you love epithelial, it's like the soft tissue in your mouth, bulky mucosa, the gums, etc. Epithelial cells are great. They love to cuddle, they protect you, to do all wonderful things, but they need to be told what to do. If you give them bad information, they're going to do really weird things. And I'm going to tell you how information gets to them in a clear, coherent way. When the body's not speaking to itself in a clear, coherent way, weird things happen. Oh my God, I got cancer. No, I just was told I got cancer yesterday. No, you don't get cancer yesterday. You get cancer 10 years ago. And it's just to the point where we start to see symptomatically. These chronic deep diseases don't start yesterday. Chronic periodontal disease in a classical sense doesn't start a week ago. It slowly creeps as things change, things become more chronic and problematic. So what we try to do in thinking biologically, we do synergistic therapies, and number one, to change the ecology back to a favorable environment, to get better circulation. And this is go back to even clear osteopathy. Good blood in, good blood out. Good lymphatics in, good lymphatics out. Thinking differently, all we're doing here to change is where we have regulated tissue, once again, what we consider healthy tissue, is thinking how we can support that patient's innate healing processes. That's the essence of biologics, okay? So we go from a situation like this, where basically we're looking at the ceiling of this guy's sinuses to where we get healing and regulation of the tissue, once again, not going there and yanking this dead bone out, because that will create all kinds of problems. Let the patient push this bone out, this unhealthy bone, which the body has the capacity to do, and support its healing process. And there's the multiple different ways to do that. We can spend quite a number of days. Today, we see things like extraction sites, in this case, done 7 years ago. Why didn't it heal? What's going on here? Was there bacteria in here? Well, this patient had what was considered Lyme disease. I don't even know what Lyme disease is anymore, because you got all these other co-infection things going on, and that really changes the whole ecology and biology of these systems. Ehrlichia, mycoplasma, BCella, I mean, these things get in, and what they do is retard healing. They find weaknesses in the body and don't allow the normal healing process go on. When you see demineralized areas or defects in the bone, that's a reflection of infection and or inflammatory states. Infection inflammatory states are what? Very positively charged. They're acidic environments and lack oxygen. Biologically, okay, we understand that acidic, lacking oxygen. Are there therapies that allow for that to reverse itself? Because this is also the thing you see in healing bone. You hear about discavitations, all this kind of stuff. The only way you recognize healing in bone is by the remineralization process. That's the only way you understand there's true healing. Because once again, if there's infection or inflammation in bone, you cannot get remineralization. It's impossible. It's basic biophysics. All the minerals that recalcify or remineralize that osteoid structure is positively charged. An infection inflammatory state is also what? Positively charged. Charge repulsion. So the key indicator, you start to elevate the pH into a more alkaline state, change the environment, and that allows for a reduction in inflammation, infection, and remineralization. which we see in a case like this. And this is cases where we use ozone, different type of remedies to support, once again, that patient's innate healing process. Once again, we can see we're allowing here non-surgically going in there, not gouging the bone out, supporting the patient's healing process itself. Now, I got a couple of cool cases here. This is from my friend Lou. Is Lou here? Lou's not here. Remember this case, Barb? This is a case I worked with Lou Travato and his wife Barb's right over there. Great dentist, I think. Oh, that's right, you're not a dentist. Anyhow, this case, this poor guy had surgery, cancers. They cut out his part of the sphenoid bone, his maxilla. They radiated the hell out of him. And they said, well, you know, what can we do for you? I mean, he had an obturator, he had unhealing wounds because of the damage from the tissue itself, from all the therapies he received. And basically the physician said, well, there's nothing we can do, at least you're alive. So this is when my friend Lou, always we work cooperatively on some of these more interesting cases. How can we can help this patient support that innate healing process that he has, okay? And we'll look at the tissue. Irradiated, burnt, dysregulated tissue. The epithelium is destroyed. The basement membranes are upset. The matrix, we'll just talk about, the terrain is. How can we once again get this patient on the pathway to healing? Well, this is when we bring oxygen ozone therapies and a multiplicity of different therapies together, thinking biologically, how can we support that healing process itself and return to a healing phase where we open up the vascular beds. Once again, they're damaged. You get them open up the deeper matrix, which I'll talk about in a little while, and support that patient's healing process. You know, with these patients, you can't go, you're healed. No. Recognize that they can heal themselves. And that's one of the important things in the biologic world. We're going to talk about the interesting biologic patient, is that they have to take on the responsibility for their own health and wellness. If they come to you or a physician say, heal me, oh boy, it's not going to work out. You can help them, but they need to help themselves. So we go for this type of tissue, and thank God we're able to help that and change that dramatically for this guy and make his life a lot better. Thinking biologically and using biologic therapeutics. And biologic therapies take time. It's not like taking, I got a headache, I'm taking an Advil, oh, I'm cured. No, it takes time and patience. But it's a beautiful, intelligent way to do dental medicine. So we know, once again, Mike Goswell in a little while will talk about periodontal disease and its far-reaching implications and how the immune system is dramatically affected. You know, we're thinking about advanced periodontal disease as autoimmune disease today. Those bacteria, they're not dumb. They hijack things. They hijack your immune system so they can escape into the epithelium. You know, these are smart. These are not stupid things. And we know the far-reaching implications, once again, of all different types of infections throughout the body, affecting joints surgically. I mean, today we're seeing more and more physicians, before patients become surgerized, go to your dentist. Make sure you don't have any infection in there. And the biggest problem we see in the biologic world, even the dental world, traditional dental world, is stealthy infections. When you think about it, I mean, I came through the era of 3D cone beam before it was 3D cone beam, and we look at those cone beams now, we go, ooh, where did that come from? The problem with a lot of the things in dentistry is that patients don't feel it. I mean, you take a 3D cone beam, you see big holes in the jaw, and it's like, I never felt anything. So it's kind of slow, insidious infections when you leave that colonized state. Slow and insidious creeps up on you until you just can't handle it anymore. And what factors today, we're dealing with? I mean, it's tough out there dealing with patients with different issues. Think about the drugs, aging, lack of hydration. How many patients come in, a simple remedy, how many patients are dehydrated? Simple test, remember that old simple test, just pinch your skin. If it stays up, guess what? You're what? Dehydrated, okay? I cured many headaches with simple what? Drinking water in the proper way. And we battle drugs today. The pharmaceuticals. How many patients yours come in with a bag of drugs. Taking this for that, I'm taking this to counteract that, this to counteract that, and that. And how many drugs have fluoride attached to them today? 200-300 of them now? And we have a pharmaceutical guy came in, biochemist, and says, why do you put a fluoride, on a molecule like that? Is there a specific reason? No, we just can get rid of it that way. I'm like, oh, that's great. That's good news. Okay. And of course, once again, we realize pharmaceutically based, many drugs promote tooth decay by altering salivary flow and altering the pH. I mean, a lot of these patients are taking drugs by the handful and they don't drink any water. This is one of the first questions, of one of the number of questions we ask our patients when they come in our biologic world. How much water do you drink a day? I have a cup of coffee. No. How much water do you drink a day? I have a cup of coffee. And doc, my joints are achy, my back hurts. How much water do you drink? A cup of coffee a day. That's why you're so damn achy. You have to hydrate yourself because that's, once again, the universal what? Solvent. That's how you wash your body out, by good, clean hydration itself. That's for sure. Okay. So, once again, that concept where infections, where we've left the world of colonization. Remember, when I talk about colonization, it's that 90% of us living happily together. Okay, we've attacked that for years. The character of those bacteria have changed. Those ancient bacteria, that these little colonies make a certain little something that this other colony likes and supports them, and this colony supports this colony, and ultimately that colony gives us what we need, help our digestion, protect ourselves and our GI tract, etc. So, but when something emerges, your ecology shifts that allow some pathogenic forms to emerge, because I got news for you, we got everything, okay? It's just a matter how your ecosystem is working. These infections emerge. And once again, they're producing all kinds of toxins, etc., and it has far-reaching implications. There are no barriers from the mouth to the rest of the body. In dental school, remember, nothing existed, below what? The mandible. It was just some kind of meat suit dragging a head around so you can have jaws. It's true. Think about it. Well, there's nothing down there. Okay, great. Wrong. We are but one. Okay. So the things we deal with today, a lot of these genes have been proven to be effective in treatment of infections, but have what? Dramatic side effects. On the left, you see sodium hypochlorite coming through root canals using Clorox or bleach. Here, of course, Fosamax, the bisphosphonates. And we have to deal with these issues and be aware of them. Are there better ways to go or different ways to deal with these issues, and how do we help heal them? Bisphosphonates. How do you fix that? Okay? My oral surgeons, just put them on Paradex the rest of their life. It won't hurt. Like, what the hell are you talking about? Okay? So these are side effects we have to deal with. So the problems in dentistry, as you know, are kind of interesting. I mean, a lot of physicians hate dealing with head and neck problems because they're so damn complex. Because, sometimes a muscle, like a temporalis muscle, can create tooth pain. So there's muscle pain, ligament, joint pain, tooth pain, perio pain, nerve pain, or a combination of the two. It's always complex in the head and neck. That is for sure. And human diseases today, there's infectious diseases, they're hereditary disease, genetic, non-genetic, nutritional, physiologic diseases, communicable, non-communicable. Perio, as we know, is communicable disease. So how do we deal with that as a reflection in the head and neck itself? But a lot of these disorders, of course, are influenced by eventually the ecology shifting. Okay, we see ecology and biology changing to allow emergence of these pathogenic forms, which you all have. In a colonized state, everything is balanced, everybody's harmonious, things are kept in check. Things change over time, allowing for opportunistic bacteria, virus, or fungus, or even parasites to start to dominate. And of course, infections, they can be acute, which we catch them right on, and we can sometimes knock that down. Or the more difficult ones, the chronicity ones, the chronic ones, the stealthy, sneaky, slow, insidious ones that we don't feel. We see a lot of times that happens in our infamous root canal world. And remember, there's root canals and then infected root canals, two separate things. And of course, now we know it's bacteria, it could be virus, fungal, parasitics. In dentistry, we should concern us that there are parasites in dentistry, as you'll hear about later on today. And it's usually a combination of things. It's not a thing. And some of the biggest mistakes we've made in the endodontic world is that when I was brought up in dentistry, is that, oh, it's always bacteria. So what do? The first thing we do with root canal people, slam them with antibiotics. And we used to routinely just put everybody on antibiotics. Everybody, hey, it's great, it's like candy. The problem is, when you knock one population down, something else, what? Emerges. And what emerges in infected root canals is fungus. You know, I didn't realize that until we started doing ozone research years ago, realizing the big fungal nature of root canals that are infected itself. So, you know, how can we deal with many of these acute and chronic craniofacial dental therapy resistant infections in a multiplicity of way? And this is where we get into the integrative dental, biologic dental medicine model itself. So how do we define ourselves? We're dealing with all these different issues today, which you kind of sort of haven't dealt with for years, that are emerging: longevity, chronicity, different type of chronic diseases that we're putting names onto today. And a lot of times these pharmaceutical agents are just not working. How can we help the patient heal itself? And we need a model to work with them. So this model is defined as a dental medicine that partners, and this is critically important, the patient and dental practitioner to develop and integrate biologically safe, effective, established, and emerging treatment modalities. And this allows for treatment that is not really subservient to any one school of dental thought. So what's important is that we get the patient intimately involved in the therapy and care. Because when you think about it, for a simple example, I have a periodontal patient. I put them on 3-month recalls. Fantastic, okay? Think about how many hours there are in a year. How many hours do you see this patient? 4 hours out of the year. What counts, your 4 hours or the gazillion other hours that they're supposed to be home taking care of themselves? You could set the stage and help them, you know, get that pathway to healing, but if they don't take those other gazillion little hours, you suck as a dentist, right? Oh, the dentist didn't do it right. Always the dentist's fault, remember that. So in the integrative model, we take the holistic principles, you know, biologic, physiologic, mainstream principles. We don't throw anything out because each patient needs something unique. And that's what's important. This is where you start to think differently. Don't put everybody in the same box. Everyone needs something different and unique, and that's what makes it so interesting. Integration, once again, utilizes all those principles above for the patient's wellness and health itself. So we use these principles to diagnose and treatment of human disease itself, for we are but one. And this is one of the most important things we have to transcend. In dental schools, you know, that kind of thinking they have, once again, you don't think about the rest of the body, but the implications of what you do, even prosthetically, orthopedically, classic dentistry, and thinking in a deeper sense the biologic underpinnings of disease and treatment modalities you're going to use, once again, has far-reaching implications itself. So when you think about integrative treatments regimes, you have, you know, of course, antibiotics, antifungals, antivirals, antiparasitics, antiseptics. So by the time you give them all those, you've cured them but killed them at the same time, okay? And of course, then we get into essential oils, plant extracts, homeopathics, wonderful laser therapies which are using today, ultraviolet light, and of course, oxygen ozone, which we love so much. Let me go back. So we have these different modalities. How are we going to use them? How are we going to understand them? Because once again, when these biologic patients come in, and these are awesome patients, if you appreciate them and understand them. You will never not be busy in the biologic world. Trust me. If you're the great cosmetic dentist, the economy flops out, you're going to be sitting around. In this world, you will always be busy and very busy. So the typical biologic patient is a health person. I want to stay healthy. I heard getting rid of those amalgam things are good. Get rid of that. I heard about infection. I heard about, do I have cavitations? How are my gums? I want to stay healthy. Those great patients. A friend of mine told me years ago, he said, Phil, you can spend the rest of your career just taking out that crappy amalgam and do very well for yourself. And it's very true. The ill person, see a lot of those. They come in, they got cancer, chronic fatigue, autoimmune diseases, and they're trying to clean their ecosystem up. They're doing chelation therapies. They're doing Chinese medicine. They're doing herbals, homeopathy. They're with functional medicine people. Now, if you're doing chelation and you used to have a bunch of mercury fillings in your head, what good are you doing? So our job is to get the resources, those sources out. To set the stage, remove infection, remove toxic elements from the patient in a safe and functional way. Once again, remove another barrier, allow them to heal themselves. And the woo-woo. Everybody loves the woo-woo, right? I mean, get ready. They're coming in. They're awesome. They may come in with aluminum hats on. They have dowsing rods, tachyon beads. But listen to these people. These people do their homework. My favorite, I said this, was in Vancouver. Griffin called and said, Phil, you got to tell this story about this lady who did the ultimate grounding of herself. The ultimate grounding. She comes in the office, new patient, and I usually stand in the hallway, see him come on up, and she's going like this. Maybe she got a bad hip or something. You get all these kind of issues. I look down, I see a wire coming out of her pants. Then, she's getting closer. She's kind of coming up these little 4 stairs I have. I said, how you doing? You got a wire hanging out of your pants? Oh, yeah. Great. It's copper. Oh, yeah, of course copper. And I says, okay. What are you doing with that? Oh, I'm grounding myself. I said, oh, wow, okay. Okay, here we go. I said, great. Was it like wrapped around your ankle? Oh, no. Oh, no? I said, where does it go? Oh, right in my butt. I says, right in your butt? Oh, yeah, I want to ground from my ground chakra right down to the earth. Okay, well, you better sit down nice and easy. She's a great patient. I got 1 million patients from her. Because it was like, okay, that's fine. So, one of the first things we teach our students, the language of the woo-woo. Listen and learn, that's for sure. It's rough out there, trust me, believe me. So anyhow, and of course the traditional patient. I mean, our practice started out 36, almost 37 years ago. Very traditional, I grew up in this town and, friends, family, everybody and their brother came in, that's fine. And it's funny how we're seeing like the grandchildren now of everybody, which is kind of interesting, been around that long. But our practice has transformed over the years from kind of a local practice to kind of a national, international practice where we have people flying from Europe and drive hours. And if you've been in this business long enough, you have these people travel. I said, why don't you go to someone and look, oh, I got to see you. That's great. Oh, my God. But, that's fine. But we get the traditional patient, heard about you. That's great. And then, you explain to you, slowly turn the ship on them, slowly. Because there's a couple of kind of patients with the mercury kind of concept. When we talk about the mercury thing with these patients, they come to you, oh, I want these mercury amalgam things out of my head. Okay. So we kind of discuss, the pros and cons of it, understand we can wind up killing your teeth for you. Or these other patients, traditional ones, that they just want the tooth to look like a white tooth, okay? But we slowly educate. It's an educational process. Even with our new patients, we take time to discuss, I mean, what do you want? You know, what are you looking for as far as health, wellness, et cetera? And what's important is that be able to have an intelligent dialogue with them, because these people do a lot of homework on their stuff. And the problem is the internet. Ooh, if it's on the internet, you know it's true, right? Okay? So you have to kind of, they get all this information, but to put it in perspective, that's kind of your job, and that takes a little time. So each of these, type of patients, have their, of course, their own special needs. So what are they looking for? Okay, well, they're looking for better health, and this is a process of getting, better health, of course, getting toxins and metal out of their mouth and, keeping their periodontal, the whole kind of biologic concept with them. Solutions to their illnesses, the chronic illnesses. And this is a trap you got to be careful with. Because when they come in, I know these mercury fillings, once they're out, my cancer, my chronic fatigue, or whatever is going to go away. Woo, time out. You got to bring them back and say, this is all this is going to do. We're going to take it out in a very careful, special way. But this is going to take a burden off your body. Is this the cure? I can't guarantee anything. I've seen amazing things. I mean, I had one kid come from California, had one filling and occlusal done. 2 weeks later, she was diagnosed with MS. Came from California, a friend of mine, Dr. Ali. I took the mercury filling out, did some chelation work. The miracle cure. It all depends on their capability for detoxification. We all have different capabilities for that. But once again, with these patients, don't get to the point where you promise them, this is the ultimate cure. Big mistake. And sometimes, wow, awesome. I mean, my favorite is, sometimes if patients come in, a couple of them I remember very clearly, is that they came in with a bad root canal. And these were young ladies, had root canal years ago when they were kids. They couldn't get pregnant. We took the root canal out. I made a homeopathic remedy. There's some tricks we do, we learn and do for them. And my favorite is when the patient came in, I don't know how many, a couple of months later, she comes in, yells at you over, Dr. Mollica, you got me pregnant. Goes, is my wife here? Wait a minute, I had a vasectomy years ago. Did I say that? Oh my God. So, I mean, you have awesome days like that, okay? I mean, it happens a couple of times. It's amazing. A lot of times, no, you do all this stuff and you know what? The changes are subtle and they have their homework to do. You're taking a burden off their system. That's what you're doing, okay? Clearing a pathway for them to heal. And this is why it's important that you develop relationships with other like-minded practitioners, integrated practitioners, functional medicine people, naturopaths, etc. But you have to understand what they're doing also. And you plug holes in your practice, which is necessary to help them and help your patient. So solutions and causes related to the general health status. Once again, I know this is causing the problem. You can't say that. So you have to kind of redirect them a little bit. And heard it was a good thing to do. It's a great thing to do. It is, getting that stuff out of their head, getting it biologically safe and non-toxic, non-challenging to their overall health and wellness. So what are they really looking for? Okay. A dentist that understands biologic concepts, that understands different healing systems. Because they're going to come in, I'm doing traditional Chinese medicine. I'm doing Ayurveda. I'm doing homeopathy. I'm doing osteopathy. I'm doing this and that. And it's good that you understand that you don't have to be experts in it, but you have an understanding of the different healing modalities and how they're going to affect and direct your therapies. Important to understand. And understand, integrative alternative medicine as it relates to dentistry. That's why they come into you, because you understand these things and can relate your therapies to them and have a conversation, because that's one of the biggest things, to have an intelligent conversation, because they're going to question you, which I'll talk about in a minute. Understand the concept of detoxification. That's big. Everybody's detoxifying today. They're cleaning out their house. Not their house, their house. And how are they doing that? Are there implications associated with that? Are you detoxifying right now? Is it the appropriate time to take these fillings out? Is it appropriate enough to take these infected root canals out? These are the things you should understand, what's appropriate for them. Understand, of course, biocompatibility of dental materials. That's important. There's different tests out there, from Jess Clifford's test, these different type of tests. At least when I use these biocompatibility tests, I use them as an assessment to see trends, okay? And if we have to pick a specific material, it kind of guides us in that direction. But it's a great assessment tool, and these patients come to understand that, okay? Biocompatibility. Understand, of course, foundational nutritional concepts. What are you eating? Oh, I'm sick, I can think, but as soon as I got a date at Burger King in about 10 minutes. I want the Impossible Burger, I'll be safe with that. What the hell's an Impossible Burger? It's probably impossible. God knows, okay? And understand supportive therapies as it relates to biologic therapies, okay? Once again, doing extractions. Are you giving lymphatic drainage remedies? Are you customizing some remedies to help them detox or making antidotes to taking the mercury fillings out? One of the most important things we do is when I take these mercury fillings out, I'll take each sample and I'll make a specific remedy to that. It's a very simple type of things we do. So once again, you're giving the status, here's your antidote for what we did today. All I'm doing in a homeopathic remedy is helping the body educate itself to recognize this type of mercury, a type of filling in their body, and help what? Eliminate it in a safe, effective manner. Okay? Very carefully do that. Okay? Understand safe protocols, and most important, understand them. Just don't look at them like they're crazy, even though they are, but so are you. Okay? So you're crazy because you're dealing with this world, but it's awesome. Okay? And you'll learn a lot from these people, okay? Understanding them. We've all heard, no one listens to me. No, I'm listening to you. I don't mind. I got nothing else. I have no place to go. I'm hanging out. All right, so understand them, of course. So why did they pick you? Why were you so lucky? Okay, why were you lucky today? Okay? And a lot of them is going to travel to the dentist, and they go and they check them out, and they sometimes, oh, I'm biologic. Well, what do you do? I just take fillings out. Well, what else you do? I don't know. I take fillings out. Off they go. Okay? So, are you a member of IAOMT? Which, you know what? IAOMT, I'm telling you, is an awesome place. I've been involved with other organizations, and this is, my favorite, because everyone's like a family right here. We all help each other. So it's important for you to be a member of IAOMT if you're being new here, but they check you out on their website. Okay? Are you trained? What's your background? What have you done in relationship to this biologic concept that makes you stand out and understand their particular issues? Word of mouth, that's my favorite type of patient. We're not big on that website stuff, and believe me, we have plenty of business to deal with without going out marketing it. Believe me, these patients come in, you treat them right, you understand their issues. It's a whole subculture out there of woo-woos. There's millions of them. And we're always willing to share with you. That's for sure, okay? So you believe me, you have not much marketing to do to be successful. Are you board certified? Are you certified? Which means that at least you have some minimal competency, understand. They look for these things, okay? Oh, you're a nice person. Even though you say, this is insane. Oh, I love you. You're a very nice patient to me, okay? So you're nice. And you listen and learn. I've learned so much by just listening to some of these patients and some of the remedies they have, some of the things that they do. You think like, holy cow, I learned a lot about colonics. Everybody like colonics here? Barbara, I know you do. I know you do. But, those are wonderful things. And maybe you all are none of the above, and they just kind of search you down, okay? So, be prepared for the woo-woo quiz. Be ready, but it's worthwhile, okay? Be prepared to spend time interviewing the patient. Don't give them the $50 special. This is not, your typical, oh, let's take, okay, here, this is your bill, get the hell out of here. No, charge them $300, $400. Sit down, they're happy to pay it. Sit down and talk to them for an hour. You'll learn a lot. You'll learn about what their needs are, and they'll go out of there, that was awesome. They go to the physician, Who are you? Here, take this. Here, get out of here. I got 5 minutes. I have a lot of physician patients of mine. They work at great universities. They're only allowed X amount of time per patient, and they're monitored constantly. That's insane. I'm in my own business. I do what the hell I want. So charge them. Believe me, your information, your intelligence, your ability to spend time with them has great value. It's not a $50 or $90 visit. Charge them accordingly, but spend the time talking to them. And then that will give you a sense like, ooh, I'm not dealing with this person. Or, this is fantastic. Let's set up an appropriate treatment plan and do what's right for you. And be prepared to answer the questions when the sheet of paper comes out. The old piece of paper comes out. I have some questions for you. That usually happens a couple of ways. In the beginning, or when you're treating them, and you get up, we're done for today. Thank you. Here's your remedies. Everything's beautiful. I have a couple of questions. I have more questions. Oh, man. I got to go back. What do you think about this remedy? What do you think about that remedy? Okay. So be prepared for the question sheet. That's fine. And explain what you're doing in detail. When I talk about this mercury thing, I give all aspects to it. In our biologic world, it's a toxin. We want to really get rid of it, okay, in a safe, effective manner. And you know what? You don't have to do anything. I tell my patient, every one of them, first of all, you don't have to do anything. You don't have to do anything. And then I get the position, the American Dental Association, the FDA, oh, mercury is the greatest stuff on earth. You can put it on burgers. It's amazing. Okay? So they understand. Educate them. Educate. And guess what? Sometimes you have to repeat it 10 times. Am I right? And all of a sudden, oh, I see. Okay. So, and be prepared to understand their healing models, what they're doing. Are they in acupuncture, in the Chinese medicine, Ayurveda, all the things I spoke about? What are you doing right now? What things are you doing to yourself? And that's important to understand because it has really deep implications when you're thinking biologically. What are they doing to themselves? Is this affecting the healing model you're seeing up in their head and neck? Okay? And, of course, as you learn the healing models, be prepared to answer questions. How do you feel about colonics? Ooh, it feels good, right? All right? Yeah, I figured some of you get that. I'm taking some drainage remedies for my gut. What do you think? And they'll bring out their remedies. Or they'll bring in the bag of stuff. Okay? I can't tell you how many patients over the years, I said, what are you taking? Oh, I'm taking so much stuff. Why? I don't know. We'll bring your bag in next time with stuff. So they bring a wheelbarrow. Okay, fine. Let's sit down and go through with it. Okay, then I'll line up all the stuff. Okay, fantastic. Okay, he's taking 4 pounds of vitamin Bs, 3 pounds of this. Great. You want to come to my garden? You're a great fertilizer, for God's sakes. Remember, the human body doesn't like to be overwhelmed, okay? It's a concept what's called hormesis, okay? It's hormesis, and this goes back to ozone therapy. It's a lot of therapeutics. That less is more. Less is more in the human body. The body likes, ooh, you're nice. Oh, we're subtle. It doesn't like that. Because it will shut down. You're taking tons of stuff, and there's no rationale behind it. Your body's going to crap it out. Okay, fine. That's great. Easy does it. Less is more. And that applies especially in the biologic world. Because when you get back to your basics of biology, you realize a little bit goes a very long way, but you got to get it into the system. And that's another whole story in itself. Of course, once again, be prepared what they're currently doing. Are they detoxifying? Are they taking herbals? Okay, homeopathics. Waiting for a connection. Oh, we're connected now. Oof. Oh, technology, beautiful. Anyhow, so it's important, once again, ask them what they're doing and what they're taking, especially herbals. Okay, we just had a whole herbal day last Saturday because people take herbs like they're taking supplements. Supplements are one thing. Herbals are medicine. You take it for a specific reason or a specific time. Say, for example, I've taken echinacea for the last 6 months, and I still don't feel well. Well, because after 2 weeks, it doesn't work anymore. It stimulates the immune system, does its job, and that's the end of it. Or, I'm taking lots of ginkgo. Well, that's kind of like a brain drainage remedy, but what it does also is what? Thins your blood. So you take a tooth out. Great. Why the hell are they bleeding all over the place? What'd you take? Did you take an aspirin today? No. I says, oh, I took some of that ginkgo stuff. Oh, great. Okay, then you got to take some other tricks to clog them up a little bit. So take the time to find out what the hell they're taking, and it doesn't necessarily mean you have to understand exactly what that herbal is, but you can know, go check it out, because most times they don't know what the hell they're taking. That guy told me to take it, it's good for me. That erectile thing, I'm telling you, it works good. You know what I mean, Bob? And there you go. Anyhow, so the biologic patient does their homework, okay? They check you out before the visit, that's for sure. They talk to their friends, their neighbors, whatever the case may be. They go on the infamous internet, okay? In the first visit, they come in and check out your office, you know. Are things calm, professional? Is the energy good? Yeah, oh, I feel that, I feel it feels good, okay? And they look online, you know, YouTube, websites, the online evaluations, you know, all the trolls in there. That dentist ripped my face off, oh my God, you know? What the hell is that? And then, of course, once again, that quiz concept, you know, they ask you about, they quiz you out, and if you pass the quiz, great, let's move forward on your therapeutics and develop a nice treatment plan, charge them appropriately for your special care, and all this extra stuff you have to toss in, the drape them, everything else. Make sure you charge them for these things, okay? And they love to pay. This is the beauty of the biologic patient, which was different from the traditional like insurance head, okay? They're willing to pay for your service and your time, okay? One of the most important things we'll tell our patients today, listen, I'm not going to treat you to your insurance plan, okay? I'm not going to have the insurance dictate. I'm going to tell you what I think you need, and we can work on this together. This is what you need to restore your mouth or a state of health and wellness, okay? If you want the insurance treatment, there's a great clinic down the road. You can go there, get your holes filled, and have a good time, okay? Take that stand, watch it. Naughty over there, that's for sure, okay. And so, most are not nuts, okay. We're all crazy because we're in a crazy-ass profession, that's for sure. And it's evolved, but you're evolving into an incredible world. There'll be always the dental mechanics, and that's important to us because we make good money doing that stuff. But now you're transcending to a different way of thinking, and believe me, it's kind of a weird thing. You're changing your shift, and many of you know, I've known for years, have done that. And the whole energy of the office changes, and it's like some kind of radar signal goes out, and here they come. They start evolving into your practice, and you'll do extremely well. So, once again, most are not nuts, okay? And just go with it, man. Just go with it. Just go with it, and, you know, and you'll learn and have really great patience. You know, it's amazing how from one patient, like holistic moms, we have an incredible Hasidim group, of a Jewish group, that one rabbi came in, and it's like a flood came in after him. It's amazing. You treat them right, do the right biologic thing, they do their homework. It's amazing. I mean, I like keeping my wife busy, keeps her practice very busy. I don't want to work that hard anymore, I'm too old. Anyhow, in summary, to some degree, the patient experience, you know, it's all about fun. I always tell them, do you have a good time? They're looking at me, what, a good time? I said, I'm having a good time, and being friendly, be informative, and a health resource. Now you study, do your homework, you learn about these different methodologies, and I'll tell you, a lot of it, you know, these patients are just kind of in this weird abyss. They don't know what to do. They're not well, they need guidance, and then when you develop your network of different physicians, integrative people, foundational, functional medicine, natural, whatever the case may be, Chinese medicine, you can help guide them in these particular areas. So you develop a network of individuals that you can resource and help them. Because a lot of these patients need guidance. They need to be supported in what to do. They don't know what to do to get themselves out of this particular problem. being on time, if we try to be organized, neat and clean, typical dental stuff. Listen and learn. That's one of the greatest things I've learned over time when I was in the oral facial pain world. Just listening starts the curing and healing process for sure. Respect them time and give them time. Adjust your fee for the time. One of the things I learned from my dear friend Griff, and he actually really enforced it, is that, years ago, we used to see like 20, 25 patients a day. Man, no way, that's dopey. We'd cut down to 6, 8, maybe 10 patients a day, if that. Make a hell of a lot more money. It's a hell of a lot less stressful. But in this world, you can do that. You don't need to hot seat patients. When I was a kid dentist, I would, worked in clinics. I had to get a job. This world is vastly different. You spend more time, less stress for you, you concentrate, and you make a hell of a lot more money and a hell of a lot more stress, okay? And of course, we're concerned for their issues. The pain, discomfort, aesthetics, the biologics, all the typical dental stuff. But we're trying to understand what the hell they're going through. And a lot of these people are traumatized. Sometimes they're difficult to deal with, but once they recognize your caring nature and the supporting process of the healing process, and I hit that thing again, things shift in a much better way. And communicate your goals and how you can help them in unique and different ways from all the medical dental practices. You are unique when you enter this world. And you all know what I will call it, I hate the term traditional, but traditional dentistry, go to Aspen Dental or one of these big clinics, that's a different world, man. We're drilling, we're filling, next, drilling, filling. It's a different world. If you want to practice in that, that's great. You'll burn yourself out. All my friends that did that are either dead or have heart attacks by now. I'll pass on that. I want to have a good time. I'm going to have a good time, relax, enjoy my patients, enjoy what I'm doing. And this is a great way to do it because you're talking about health and wellness. And you are a huge contributor to that process itself. How are we doing on time, son? 10 minutes. Okay, great. So when you start thinking biologically, we start thinking differently. We start thinking about what's going on, that's the underpinnings we're seeing in these particular patients. And as dentists, don't lock yourself in. As biologic dentists, you are transcending and looking at the patient as a whole. I'm not here. So, there we go. It's a rough crowd over there. I'm going to tell you what's going on. So, we think about simple things like, our primary nutrients in life. What are our primary nutrients in life or what? Water and what? Oxygen. So the basis for chronic diseases, or we shift into that disease state, remember when we see a disease, there's a long history prior to that before we start to see these physical manifestations that we see called symptoms itself. So also it has a lot to do with how we're using oxygen itself. And we can see where we see patients today, we're into sleep and sleep apnea, the lack of oxygen, and these people having heart attacks, and they're shifting metabolically because of lack of utilization of oxygen. But the things we're dealing with today, years ago, the concept of homeopathy, which I'm sure you all heard about, when it was really developed back in the 1800s, they were dealing with what? Sanitation issues. That was their world, sanitation. Today, what are we dealing with? Environmental issues. So that world has changed to relieve these environmentals, which are the biotoxins, the biocides, meaning heavy metals, pesticides, solvents, and of course those pathogenic forms when they emerge at colonization. And that affects how we utilize oxygen. This is the work of Dr. Ali and Dr. Otto Warburg going back last century about utilization of oxygen and the causes of cancer itself. So in our world, it's so important in your practice that you learn how to take care of yourself also. Because as we heal others, we're healing ourselves. But you better protect yourself every day when you go into the office and start popping those metal fillings out. You better be taking things like chlorella, trace minerals, nurturing your gut every day. okay, because you're constantly being exposed. You know, we take all these precautions, which I'm sure Bill talked about today, from the spacesuit thing to mask and all this kind of stuff. Fantastic. You think that's 100%? No way. Remember, I mean, years ago they had this great video, okay, great video of a dentist in a dental office, probably a stand-up dentist, and they hooked up water supply to his unit there, and he did his dentistry all day long. And they put this fluorescent stuff in his water. That night they lit it up with a fluorescent black light. The whole room was coated with it. Remember, we deal in a world of what? Edwards? Microbes and aerosols. So you're constantly breathing stuff. I think after probably 20, 30 years, a dental office maybe should be condemned as a biohazard. But leave it to the next dentist. Okay? So we're dealing with aerosols and toxins that way. So we have to protect ourselves. So ideally, and therapeutically, you know, we have certain therapeutic goals biologically with our patients, you know. We want them to have proper restoration of oxygen metabolism. We want to keep a friendly ecology. And that goes from the gut. And remember, the oral cavity is the beginning of the gut. We certainly know where it ends. A healthy oral cavity is critically important because of the pH, etc. Digestion starts in the oral cavity. Are tonsils important, or should we cut them out? Tonsils are critically important. They start talking to your gut right away. It's a sensory program. It talks to what's called GALT, gut-associated lymphoid tissue. When you're chewing food, your tonsils are saying, okay, well, can we deal with this? Can we tolerate it? Or do we have to create a challenge here? Everything is but one thing. So our job is to keep it as healthy as possible. Once again, transform that infective state back to a well-balanced ecology or colonization. We need, and Mike's going to talk about that later on, about a good colonized oral cavity. The bacteria in those pockets, okay, are critically important if in a healthy ecology. They produce all kinds of good things for the periodontium and the dentition itself. We don't want to blight it, maybe reset it, but then recolonize it in a healthy, proficient manner. We want good circulation throughout the entire body. Immune activation, immune system up and regulating properly. That's critically important. This is why you nurture your GI tract. We've seen these diseases come. We are 50, 60 years old. The microflora is changing the GI tract, and when that changes, okay, you're constipated, diarrhea, all kinds of bizarre problems. These are things you talk about to your patient also. Things start to wane, so goes your health. And remember, you know, one of the other questions we ask our patients, and they kind of look at you funny, are you taking a poop every day? They're looking, where am I, dental office? You're taking a crap every day. Because if you don't poop good, you don't look good. That's one of our mantras, right? And I mean, I have patients come out, the Holly Weirds come out from Broadway and all that kind of stuff, and we ask them these questions, and I go once a week. And we'll have a couple of, go every couple of weeks? You're full of shit, man. Literally. You feel something like pushing against your throat, or what the hell's going on? Better get a suction system going or something. I don't know. Woo, hot diggity dog. But anyhow, so these are fundamental questions, and the biologic people appreciate that. Of course, once again, you want to get the humoral system, the antioxidant system, functioning well. Well, what the hell does that mean? Well, what we want to do is, you take vitamin C, right? Livon, liposomal, ester, whatever the hell it is. Remember, to quench these horrible free radicals, okay, these horrible free radicals, you take antioxidants. Well, free radicals in a balanced ecology are fine. It's information. It's not that it's bad. It's a metabolic byproduct, but it's information for your body to utilize and create antioxidants at the cellular level. Cells can quench millions and millions of free radicals on the cellular level if they're healthy and functioning right. Where if you take tons of vitamin C, it's a 1-to-1 ratio. So what you want to do is ultimately make your cells as healthy as possible with good nutrition. Some of the things I'm going to talk about as we phase into a new concept here. So we want to get that humoral antioxidant system at this cellular level to function at best possible way. Do you want to stop here?
Yeah, let's stop here.
Okay, we'll stop here, and then we will seek the truth together, ladies and gentlemen.